If you want to know how to avoid the someday syndrome, you need to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who have heard my content in the past. If you want to know how to avoid the someday syndrome, you need to tune into this episode. Before going to the podcast, what is new in life? What is better? Uh, you know, after giving a talk to my team about raising standards, that's really what the theme is about. And there's seasonality to all our lives, whether that's health or, work or vacations or life or whatever it is. And that seasonality detracts us from our like our goals and everything else we want, which is a good and a bad thing. And so right now it is a seasonality of enjoying life, but then also getting back on track. So for some of us, it's fitness, and some of us, it's just normal life and our normal work routine. So whatever that is to you, for me, it's getting back on fitness. I love fitness. After my calf strain recently, I've been trying to get back in the rhythm. As I mentioned on my last podcast, I'm actually trying to get to 6 days of training. I'm going to try for 7. And then I got my first 3 consecutive bar muscle ups. That was pretty cool. I watch people do 10, 15, 20 in a row, and I'm always amazed by it. And there's so much technical skill in it. And I'm currently obsessed with trying to figure that out. I know I have the strength now. It's just like I got to learn the skill on it. So that's my current obsession. Just good time away with the fam. I've been hanging out with my kids and just enjoying life. Truly blessed and enjoying every minute of it. And today, as we go into this episode, I got to warn you. If you need a kick in the pants, there's a few episodes where I will give you a nice little kick in the pants. If you're looking for some motivation, you're looking for some stuff to get you in the right place, this is going to be a great episode for you. It's what I share with my team. It's where I'm at mentally. Professionally, if you ask me, Chris, what are you doing right now? I am trying to raise the standards all the time. And so, for those of you who are new to my world, welcome. This is going to be a good one for you. Those of you who've been around for a while, this is a good one. You want to save in your saved profile or download or whatever it is, because it'll be a good reminder wherever you are professionally. Okay. So why am I doing this? Just purely because it's what I'm sharing with everybody on my team, in my world. My wife and I have been talking about this. So it's like when things just kind of, when it rains, it pours. So I just want to share it with everybody. I'm not going to keep that internal. I think there's a lot of people who benefit from this. All right, what am I talking about? What is this someday syndrome? This is something that I don't remember. I read it, heard it, did something, right? So the someday syndrome is really that. It's someday. Now, somebody says, "Hey, are you gonna take your CSCS?" Yeah, someday. I'll do it someday. I've been thinking about it. Cool. Hey, are you gonna go to you're gonna do a workshop for those soccer players around the corner or in the at the local high school? Yeah, someday I'm gonna do it. I'm gonna do it someday. Yeah, got it. Cool. Were you ever thinking about taking some of those sports like education courses that maybe were outside of your CEU budget or didn't have CEUs? Yeah, someday I'll do that. Someday I'll do that. That's called the someday syndrome. And right now, some of you can be thinking about like maybe you have some friends and some family right now, like who have that someday syndrome, not just professionally, but personally. Like, hey, you're gonna be going to the gym? Yeah. Someday I'll do that. Or are you want to go run a marathon with me? So yeah, someday. Yeah, I'll do that. And so you have a lot of someday syndrome, and what that does is you're not really moving. You're not really moving forward in life. You're just procrastinating. You're delaying the inevitable, which is just complacency. And when you have too much someday syndrome in you, there's no progress. And maybe you have some someday syndrome friends around you. That's where danger happens. And maybe you have a partner who's a someday syndrome. Oof, that hurts. That hurts. Maybe your coworkers have the someday syndrome. Maybe you have the someday syndrome. And so I wanted to do this podcast because I think every one of you will go through this. So I want to tell you all about it, ultimately how to avoid the someday syndrome. I'm going to tell you what it is, why, how people get it, how to conquer it, and then how to avoid it. And it's true. I mentor a lot of physical therapists, and that's what I hear. I constantly, yeah, yeah, someday, or one day, or someday, and I get sick of hearing it. I sick of hearing it, and there's a couple things on here I want you to take away from it, and how to prevent it will be a big one once you conquer it. So, here we go. All right. What is it? It's literally saying it will happen one day. It'll happen that someday, right? And that someday never comes. And uh, why does it happen? Here's why. There's a couple different people say, I'm busy right now. Not right now. It's not the right time. It's the holidays. It was my birthday. I was feeling under the weather. I'm just a little busy right now. I just started dating somebody. I just got married. I just bought a house. I just had my first kid. I just got my first dog. Those are all things that are normally going to happen in life. So all the other adventures that are going to be thrown at you somehow need to happen within that. So what people fail to do is understand that everything that's happened to you is already, you know, it's going to happen. It's just when, right? So why not throw other things in the mix? Here's, I share this with my team, and it's very important to understand. There's one thing with managing chaos. I think we all manage chaos in our life, right? You got a flat tire, you like woke up late, you forgot your lunch, your partner broke up with you, your kids are sick. That's just managing chaos all the time, right? There's a difference between managing chaos and preparing for chaos. Let me say it again. There's a big difference between managing chaos and preparing for chaos. One is very proactive. The mindset is the main difference between the two. Managing chaos and preparing for chaos. Whole different world. That's just mindset. That's no different. Now I have to ask you, which one are you doing? Managing or preparing? If you're just managing, of course, you're just swimming, right? You're just in a hole, just digging a constant hole, digging and digging and digging. And it's because you haven't put yourself in the right mindset and like understand this normal chaos is going to happen. It's just when you just have to be prepared for it. So I think that people who live in like, I'm not right now, wrong time, just maybe a little bit later. Here's why. Two reasons. One, you're not preparing for it, or you're not even aware that it's going to happen to you. I think that's awareness is step one. Number two, I think you're comfortable. I think that people put themselves in a position like, I've already accomplished this. I've already been doing this. Like, I know my thing. Who cares? Whatever you've done to get there won't work anymore. It just won't. It got you there. It's no longer, it's like irrelevant. Now you have to acquire new skills to get you to that next thing. And I think people get really comfortable with where they are. They're like, oh, not right now. Let me just coast for a while. I agree. There's seasonality in that. Great. But you can't be in there for long. You're going to get sucked into a wormhole of complacency. I think you get comfortable. I think you don't plan. And when you get comfortable, you lose confidence. You maintain the same level of confidence. You no longer have the confidence to do more. And I don't think you have the confidence or belief, self-belief that you can do it. And I think that people use excuses like not right now, I can't do it, blah, blah, blah. It's because they don't believe in themselves. They don't believe they can do it. So they just push it off to the side. And I truly believe that you need to be able to push yourself constantly. Because what happens is most people believe that they're successful. They truly believe that success is an accomplishment. Oh, that is wrong. Success is everything that led up to that thing and that will be after that thing. Success won't be this endpoint destination. It will be everything that you learned in between. And so what happens is when people reach their destination, they're like comfortable, confident, and they feel successful. Well, the problem is they no longer take on new things because they're confident and comfortable. So what's wrong with that? Then you start becoming the same, like someday syndrome. You start developing like that same phrase, not right now, I'm just busy, I can't do it. Then you just imagine chaos as it comes. In order for you to be able to prepare for chaos, you have to understand what is next. What's next for me? And I think that's the natural evolution of who you are as a clinician. And if there's time points where you're going to have a pause button professionally, I get that. I remember after having, I think it was probably Zach, my first child. I had a pause. I kept pushing. I mean, we had just opened up a new facility in Chula Vista, 2,000 square feet by myself with my wife, and we didn't have a babysitter. We literally like did this like night and day, worked. We treated 12 hours, no lunch, brought home laundry. We like made the phone calls. We replied to the emails. We did that for months. And at some point, I had to take a break professionally because I had to give myself some time for my family. And I acknowledged that. And at some point, I had to say, "Hey, not right now." And I definitely had some someday syndrome. So there's seasonality to life. But after a time, I had to like, okay, I got comfortable. Hold on, let me start taking on a little bit more. I'm not comfortable. I know I'm not. There's more success ahead of that, and I got more opportunities. I got more things offered, and I had to take those on. I had to be able to push myself to that next level. And here I am today, pushing myself to that next level to be able to support people like you. But the difference is you got to have that confidence and self-belief that you can do it first and foremost. And I think that's why people don't take it on. I think they lack the self-belief. I think they lack the confidence. I think they get comfortable and they fail to plan to be able to prepare for chaos. There's a lot of truth in that. All right. Once you realize that, all right, you're like, all right, I'm Chris, I'm in it. Like I'm in that season right now. How do I get out? All right. There's a couple different things. One, I think you need to create action, right? So I think you need to make time. I think you need to look at your calendar. I think you look at your weekly calendar, your daily calendar, your annual calendar, and look, where am I going to start to insert more continuing education courses? Where am I going to insert, that online course that I've always been wanting to take? I have people that I know personally who have signed up for like a 4-day, online course. They haven't taken it because you just haven't had time. And the reality is you haven't looked, you haven't forecasted, you've just been managing chaos, you haven't prepared for it. So I think that you need to create action. I think you need to make time. I think you need to switch your mindset. Now, I need to prepare for the chaos. This is going to be my year. This is going to be my quarter. This is going to be my month. And that deals with your same health too. Like for some of you, like I would do the same thing with my athletes and patients. I mean, like the reason why you're getting hurt is because you're not planning. You're not like mapping things out. You're just going to the gym and just doing whatever works. That doesn't work from a volume intensity standpoint. The reason why you get hurt is because you can't manage volume intensity. The reason why you're in someday syndrome is because you haven't been able to map that out. You haven't been planning. You've been just managing chaos. I think you need to say yes to more educational opportunities, more mentorship opportunities. I think you need to surround yourself with like-minded people. Now, I'm going to say something real quick here, and this is very important. So make sure to tune in. If you're at the gym, take a pause in your set. If you're driving, turn down your radio, turn down whatever it is. You're with your kids, get another room. Your parents, your partner, your best friend, they're your safety nets and they're your support system. So they're there to support you when you fail and make you feel good and support you wherever you want, right? They're just the basket underneath. They're always going to be there. That's why they're there. That's their purpose in life, to be there for you. But they are not the ones who are going to ever push you beyond your comfort zone. Why? Because that's not their job. They weren't hired to do that. They were hired to love and support you. Your parents were there to nurture you, support you. But your parents are going to let you live in comfort. Your partners, your colleagues, no one pushes you. No one. And if they do, it's like, oh, I don't want to push too hard. So what do? Get yourself some like-minded friends, some anti-someday syndrome friends, some today syndrome friends, my right now syndrome friends. Those are the people you have to get around. And if you're relying on your partner and your colleagues and those people to, like, if you present an idea, hey, should I do this? And they're like, yeah, that'd be a great idea, but if you're too busy, that's okay too. Right? Some of you are smiling right now. Those are the people you're around. Well, of course, that's why you're in someday syndrome. I'm not knocking anybody. Listen, I think those people are good for you in your life, right? But they serve a purpose. Professional development, They're not there for that. Your parents weren't hired for professional development. Your partner was not hired for professional development. Your colleagues weren't there hired for professional development. They're just there part of your life to support you, not your growth. They're here to help you be loved and supported. There's a lot of truth. I'm telling you this. The only reason you're going to push yourself is you get people who have the today syndrome, who have that same fight, the fight that you had to get into PT school, that fire to get into PT school. You're right. You were like, I remember you like you were hustling. You're doing all these observation hours. You were like in that mentorship. You were in the observation. You were with your mentors. You were like hustling to get good grades. And then you got into PT school, and then you like got comfortable, and you're like, I achieved something, and now I'm done. Okay, the seasonality. Enjoy that for 3 to 6 months. Now let's rock and roll. You just need somebody to reel you back in every few months, every few months. And I realize that more and more. And I do this to my team. All right, like you're good. Let's go. What's next? What do you need more? What do you need to kick in the pants? Because if you're around someday syndrome people, you'll be stuck in there. And I'm not going to be there. And I don't want those people around me to be in there. And for that reason, I respectfully and professionally will need to be able to push you not to the comfort zone. Like, yeah, I'm there to be to support you. Hey, good job, pat on the back. But also, what is it that you want to accomplish next? What is it that you've always wanted? And you have to keep remind yourself that you're doing okay. But if you want to live to the highest standards, like you've always wanted to be that like expert, you'll cap at who you're around. You'll cap, your potential will cap based on the people you're around and the mindset that you have. So you have to get out of that. So I don't know where you're at, and I don't know whether it's an environment thing or in your mindset thing or whatever it is, but you got to conquer that someday syndrome. Okay. So once you've done that, you're like, Chris, I've done it. I'm out. What do I do to avoid this? All right. I think you have to do exactly what I said. I think you have to create a plan, a roadmap to take more CEUs. Even if you don't have the budget, I'm so sorry. Like, it's like a copay. It's like, we tell patients and athletes, right? Like nowadays, we know insurance is being a bigger problem than ever, and it will forever be a problem. And guess what? It will be the biggest barrier and problem moving forward. If you don't know what's happening in insurance world right now, insurance will continue to reimburse less and less, have higher deductibles, and have higher copays. So that means the patient and athletes won't win. They're going to have higher copays, higher deductibles, just to see the same insurance provider who's getting less. So insurance company is winning, right? We all get that. I understand that. So what's going to happen as that gets harder and harder of a barrier? What are those patients athletes going to say? Like, oh, I can't afford my copay, but there's value in what needs to happen, right? You're like, I understand that, but if you can get over that fact that you need to pay $10 more to preserve your knee, you need to get over the monetary aspect of it and truly understand this is for your benefit, right? I think you have a passion for being able to explain that to a patient or an athlete. It's right for them. Like just pay the $50, just pay the $100, whatever that is, because it's going to set you up for success in 3 to 6 months. But you almost like need to shake them. Guess what? That's the same for CEUs. Just because the standard is you have to take 1 or 2 CEUs a year and you only have a $500 budget or a $1,000 budget or a $1,500 budget, that's like you thinking like the patient or athlete that you have a copay, like, oh, I can't pay more than that. I'm only allowed 1,000. I'm only allowed 500. I'm not going to go out of pocket. What you're saying is you're not going to go out of network. So you are limiting yourself just like your patient or athlete who knows they need more, but it's just they haven't realized how important it is and the value it's going to bring them. So when you say the next time your excuse is, I don't have the means to do this, I don't have the CEU budget, you're the same as the patient or athlete who doesn't want to pay the copay. The same thing that the athlete doesn't see the value in what it is. And as a mentor, I see how far that can take you. The problem is you're with the comfort zone people people who don't push you. It's okay. You don't have to spend that money. Go ahead and have a $10 Starbucks every other week. Go ahead and have that nice dinner, or invest in yourself and make sure that you're set up for success as a professional, or you're going to be constantly in that someday syndrome. You see this cycle, right? You're like, how do I get out of it? You got to invest in yourself. You got to plan. Well, I don't want to plan or invest in myself. Well, great. You're going to be stuck in this copay with like really bad. That's the reason why people go to bad facilities, because they have low copays. So they have this high churn. The person has poor outcomes. What's the difference in your life with having out without having more, affording more CEUs or investing in yourself? Poor outcomes. You're going to be limited on your growth. You're only doing enough. You'll get comfortable, someday syndrome, no growth. Welcome to what's happening right now to a lot of PTs. And I hope that's not you. It's what I'm hearing, it's what I'm seeing. It's the truth. So what else? How do you get avoided? How do you avoid it? You're out. What do? Create a plan, take more CEUs, invest in yourself. I think you need to design like, so if you're asking me, hey, if you're like, okay, I truly don't have money right now, blah, blah. Okay, great. Sounds good. I think you need to allocate time on the weekends to do that. If you want to do it at nights, great, go for it. But most people are like, oh, I have to document and do all this. Great. Give up your lunch hour. Give 5 hours of your week. Do all your documentation in the lunch hour as much as you possibly can. Be efficient with your time. Stop talking to your coworkers. Be efficient with 15 to 20 minutes after hours. Then you have time, more time in the afternoon or the weekends to allocate for your own personal development, to take more CEUs, work on your program designs, your strength and conditioning programs. My first strength programs were taking 2 to 3 hours per program. But once I had 10 of them, I had templates and I had everything written out for me. So I think you have to be more efficient with your time. You actually have to create a map and a plan for what you're about to do. I think you need to give up your lunch for documentation, give up the personal time that you're going to be, that you would have been with your coworkers. Basically, be more efficient with your time. Stop wasting it. I think, work on your personal, like professional growth over the weekend. Oh, I like, sleeping in, doing my weekends. Then that's who you're going to be. That's where you're going to be as a someday syndrome PT. Don't get mad. That's just your route. Now you know. Step 1, awareness. Step 2, action. Or actually, before action should be plan. So if you're ever in a rut, I advise you to do one thing. Remind yourself why you've always wanted to be the best version of yourself. When your parents said, hey, I want to be the physical therapist, do you want to be an average physical therapist? Do you want to be a good physical therapist? Do you want to be the best physical therapist? What type of physical therapist do you want? Well, I want to be the best. Well, what's it going to take for you to be the best? Not working on weekends? Eating during lunch so you can watch Netflix or Instagram? That's time wasted. Use that time, allocate it towards being efficient so you can have more time for growth. The reason why you don't have time for growth is because you're just managing chaos as it comes. You're not preparing for growth. You're not preparing for the chaos. Always remind yourself why you've always wanted to be the best possible version. And if you're not, which one are you right now? Are you bad? Are you average? Are you good? Are you excellent? Are you the best? And if you're the best, you're probably doing all these things, but it's momentary. So you will fall off this wagon. I'm just here to bring you back up. So always remind yourself, how would you categorize yourself right now? I hope that like kicks you in the pants and gives you like a nice little punch to the stomach. Where are you right now? And what do you need to get there? And when I say the best, it's not comparing yourself to other people or colleagues or me or anybody else. It's just the best version of yourself. Like if you were explaining to your parents or your partner, I want to be the best, and the best to me looks like fill the gap. So to me, that is how to avoid the someday syndrome. How many people are in the someday syndrome? I think 80% of PTs are in the someday syndrome. I think only about 20% are truly constantly reaching for that upper threshold, those upper standards. And if you're listening to this podcast, you're probably wanting to achieve that. I get that. And I'm here to help you. And one of the biggest things that I've done over the last 2 years probably is to create that map, literally like for PTs. And so when I say what to do to avoid this happening, is creating a map and a roadmap. So one of the first things I did was like, well, what would that look like for a mentorship for PTs? So I had to build a map, roadmap, like a blueprint about it. And that's where my uh, upcoming course, the Sports PT Kickstarter, is. The Sports PT Kickstarter is literally was my answer to a roadmap to like what would set up a physical therapist within the sports world to get a glimpse of the full spectrum of professional athletics, working in any setting, highest level professional sports, collegiate athletics in a high school, in a elite program or an elite sports performance facility. What would that look like? So I built a roadmap. And that's why I did that. And I built it online. So for those of you guys don't know, I host this annually now, and it is called the Sports PT Kickstarter. It is essentially 8 weeks online with me. And I knew people were going to say the weekends, like, I can't do the weekends. I knew that was going to happen. So I set it up during the week to hit you someday syndrome people, to hit you in the face, because if you're not going to do it, I'm going to push it towards you and tell you I'm doing this for you. So it's Wednesdays, 5 to 7 Pacific Standard Time, online with me, 2 hours every week, 8 weeks, January 11th to March 8th. Why? Because you need it. You don't have to commit to a residency. You don't have to commit to an SCS. You don't have to commit to a CSCS. This is kind of like, what would you do if I was going to mentor you for 8 weeks to set you up for success, to give you your own personal roadmap, your blueprint? That's why I built the Sports PT Kickstarter. And if anything of that sounds great for you, if you're like, hey, I'm interested, tell me more. Go on my website, drchrisgarcia.com. Go on the link, get information, figure out if it's for you. If you're a someday syndrome, you're listening to this, you need this right now. Just sign up. Just sign up to do it. And don't use the like, someday I'll do it, next one I'll do it, next year I'll do it. That you're always going to be caught up in that. I'm telling you, create action, do it now. I'll build the roadmap with you. It's your chance to ask me questions. Whatever you need, I'm going to be there. Either way, get out of the funk and keep crushing it like you set out to when you first said you were going to be a physical therapist. So with that, I hope this is a good one for you. I love these, and if you're going to be on my Sports PT Kickstarter, you're going to get a lot of this. So I will see you guys on the next episode. I hope you guys are staying healthy, happy, and absolutely crushing it. All right, I'll see you guys in the next episode. Take care.